Now, the global impact of coronavirus poses a fundamental question. Is this one of those historic moments when the world changes for good, when the balance of political and economic power shifts, or could the crisis mark a new beginning? To attempt an answer to these questions, I'm now joined by Paul Yombo, an international relations expert and a political analyst. Hello, Paul, and welcome to the program.
Hello, Gladys. I'm very happy to be here. Thank you for having me.
So how will COVID-19 influence the future behavior of nation states, governments and leaders and their other dysfunctional relationship?
Well, it's too early to draw major conclusions about how the virus will influence international politics. But we have a certain number of indications from the tendencies which we are observing. First of all, the virus is a multifaceted threat. It's a health threat, it's an economic threat, it's a political threat, and therefore it will have consequences on all of these multiple fronts. Well, on what considers international politics, the first thing that we need to note is that there's a restructuring of global solidarity links. We saw Cuban doctors arrive Italy and being warmly applauded by the Italian public. We saw bridges of solidarity created across continents where we didn't expect them to happen. So neighboring countries sometimes don't help each other, and help comes from far away. We saw the Chinese billionaire Jack Ma, who sent masks and testing equipment to every single African country. And these initiatives are not entirely new, but they are a stronger tendency than classical state-to-state cooperation. That's the first point. The second point is that the state is coming back as the main actor in the international scene. It has been 20, 30 years of neoliberal globalization where non-governmental organizations, multinational firms have been superseding the Westphalian nation state and assuming functions which were classically only reserved to states, vaccination, construction of roads.
Exactly.
And so what is going on now is that with this complex health threat, the only actor that is in full position, in full capacity to tackle the threat comprehensively is the state. And this reminds the general public and breaks, in a certain way, the dynamic of globalization that was sidestepping the state. So we will probably see renewed presence of the state. And if you look at in specific conditions inside countries, political decision makers are realizing that the concept of health sovereignty is very important, that you should be able to produce what you use in the health domain, and you should be able to be self-sufficient in such situations. So these are a few of the heavy tendencies that we're observing with this pandemic.
Now, what will you say about this? Some people say that China introduces a virus and in 3 months it contains it and starts offering help to other countries. That is their own motive of becoming the world leader and putting the US behind if the US does not react very fast, because it's now the country leading the list of countries affected by COVID-19. What do you have to say about this?
Well, the Chinese case study is something that is somewhat of a curiosity for analysts. Well, I won't go into the health specifics because I'm not very qualified for that, but on what concerns how the Chinese government tackles this crisis, there are two elements. First of all, Chinese culture is one of order, and the Chinese general public respected the instructions given by health authorities and the state. That helped a lot in curbing the pandemic. That's the first element. The second element is that health specialists have taught us that there's a bell curve to every pandemic. So there's a ex ante situation where there's a newborn that has been infected, and then gradually we reach the top of the slope, and then we start going down again. So the point where you start entering the slope depends on when you have your patient zero. China is where the virus appeared. So China had its patient zero 3 to 4 months before the rest of the world. So when China is leaving the pandemic, that's when the rest of the world is entering the crisis. So that explains, let's say, generally why China is out of the crisis right now. The second point is that the Chinese authorities have made it a point of honor to portray an image of China as being capable of tackling this kind of crisis. And that's why official communication on the COVID-19 pandemic outbreak has been extremely limited. Only authorized voices are speaking, and they are holding a common discourse that is saying that China has rid itself of the virus, though there are a few recontamination cases which are coming from the exterior, from people that are coming back to the country. Yeah. But Chinese authorities have indicated that they're probably going to close the borders once more. So the Chinese case study is very interesting. And the last point maybe is on what international relations experts call soft power. Because right now, being a big military power isn't very determining. You might have 1,000 nuclear bombs. Nuclear bombs won't destroy the virus. Yeah. What you need right now is technical capabilities to tackle the virus. It is a health system that is comprehensive, strong enough to react to this kind of virus. And the countries that traditionally are considered as powerful might not be so powerful outside of the military field. And this is what the crisis is revealing.
Okay, so let's talk more about the political consequences. Elections have been suspended in Ethiopia, Sri Lanka, the US, the UK, and leaders, unscrupulous leaders may exploit the pandemic to advance the objectives, like Vladimir Putin, who postponed the vote to allow him stay in power until 2036.
Well, let's say that every country has its own political culture. And maybe looking from the outside in, it might be very, very difficult to comprehend certain of the political measures that have been taken to tackle the crisis. And one of the defining characteristics of politics is that politics is the management of public affairs. And politicians might use, and in this specific case, which is ludicrous, exploit the conditions to further their own political situation. And I don't really think that the position we should have is to condemn or to congratulate. Mm-hmm. We should simply analyze by observing the facts. And the fact is that if there wasn't the COVID-19 outbreaks, there would be certain politicians that would be out of office, and they're very conscious of this fact. So they are trying to turn it to the best of their advantage. We'll see, for example, what the consequences of the outbreak will be on American politics. Yeah. For example, because there's supposed to be presidential election in October. In November, on the 9th of November, there's supposed to be a presidential election, and there's a lot of criticism that has been levied against the actual American administration on its management of the crisis.
You know, Paul, this pandemic is so bad that even it's causing even rebel groups to like those in Colombia, to declare a unilateral ceasefire for a month starting this April.
Yes, so you may be a rebel or you may be a terrorist, but you aren't immune to the virus. So if the virus, if you're contaminated in the bush, you will die. And it's a simple fact that these different groups are very aware of. And so they need to manage their military, strategic, and political positioning in taking into consideration the consequences, the possible consequences of the pandemic. We heard a situation that was a bit ridiculous of two terrorists that wanted to make a terrorist attack in an airport in Spain. Yeah. But the airport was empty. You see, so terrorists, like everyone else, are adapting to the situation.
So let's look at the situation in the Middle East, where war and pestilence have marked history down the ages. It is feared that the crisis might plunge into a greater chaos, and what will emerge may not be the same as what we see today. Mm-hmm.
The situation of the Middle East is very, very, very worrying for a couple of reasons. The first reason is the one that you have correctly mentioned, is that the Middle East has been ornately chiseled by the hand of history. There are a certain number of the hottest conflicts on earth going on right now in the Middle East. And what does war mean? War means refugees. War means promiscuity. War means no health system, close to no health system. It means refugee camps. And this kind of configuration is the ideal situation for the pandemic to prosper. And this does mean that the Middle East, a lot of pockets in the Middle East, we're thinking about Syria or thinking about the Gaza Strip, are exposed, very exposed to the crisis. But when you look at the situation of the Gaza Strip specifically, the Gaza Strip is isolated from the world. So there's no case of coronavirus in the Gaza Strip, for example. So the Middle East situation is a situation that has to be monitored. And to talk about the political consequences, now is a time where international organizations in charge of health are questioned. How can they help individual states to tackle the crisis? Was the correct approach the approach of federating public health systems, as was seen in the European Union? And there are, well, it's not very advanced in Africa, but there's a Center for Disease Control in Africa. That's the person in charge. Yes, person in charge is a Cameroonian, Professor Paul Yombo. And the institutions like that are trying their best, but now it's a time where their efficiency is tested.
So what do you have to say about what the WHO has been doing so far?
Well, the WHO, like I said, we can't draw conclusions already because we're early in the crisis for Africa, America, and parts of Europe. We're still very early in the crisis. But the WHO and its Director General, Mr. Tedros, they have a mitigated balance sheet for now. At the beginning of the crisis, they didn't have all of the science behind, because COVID-19 is something that's new. All the science behind wasn't there, and they actually did propagate a certain number of fake newses. COVID-19 isn't airborne. False. It is airborne. People that don't have the disease don't need to wear masks. Now health specialists are saying that everybody needs to wear masks. So there's a certain number of things that WHO didn't do because it was a new pandemic, or because they didn't know specifically what the characteristics of the threat was. And that's something that's going on also. Those are some of the criticism that are levied against the WHO, but also against China. Because since China had the virus first, the Chinese specialists had time to analyze and understand how the virus propagates and what its characteristics are. So someone like President Donald Trump, who calls it the Chinese virus, says that China didn't communicate the information early enough and clearly enough. And so what we're observing is nation states that are tackling the pandemic in their country. They take the help that they can get. Well, Nigeria refused exterior help, but the situation isn't at its apex in Nigeria already. So
if we were to pick a lesson from this on how the world just changed with a twinkle of an eye, what will it be? Well,
there are a series of lessons. There are a series of lessons that, first of all, we need to remind ourselves that what we see as apparent global stability is very fragile. In one global pandemic, everybody can be confined back in their houses. The world economy can shut down. Globalization there can be a giant break on globalization. And these are things that we need to be cognizant of when we are constructing the world order that we want to live in. For next viruses, for next pandemics that will probably happen, we need to be better prepared.
Okay. Thank you very much, Paul, for your insights.
Thank you for having me.
And we hope to have you some other time. Let's take a short break, and when we come back, we'll have a recap of our top stories.